Welcome to another edition of Climate Chronicles, where I talk a little bit about science and how it's affecting, in this case, infectious disease spread throughout the globe. An article by John Cohen and Kai Kupferschmidt titled Infectious Diseases, Countries Test Tactics in War Against COVID-19. Lockdowns and closings proliferate, but virus testing and contact tracing are lagging. I think from what I've looked at in terms of the public news articles and like NPR or KPCC, PBS, and so forth, we have obviously a great deal of spread with this virus. So this is kind of where we're at right now. We haven't gotten the testing done adequately in enough states, so we are left, and we don't have enough protective personal equipment. Therefore, we're having to quarantine large swaths of the society just so we don't overwhelm the healthcare system, and that's why you hear the term flatten the curve. Okay. And I just want to point out a few things from this article. It talks about social distancing. There's little doubt that social distancing, keeping people from getting physically close, can greatly reduce virus transmission. It was essential to bringing China's raging epidemic under control in a matter of weeks, according to the report of a joint mission of WHO and the Chinese government, released on the 28th February. Other countries are now deciding how far to take that approach. Now, my buddy Dave here pointed out an article, and I'm not even going to say the name of the quote unquote remedy, but you have to be careful with like TV entertainment, like Fox, that they kind of mix entertainment with the news, so you don't really get necessarily, that well respected or scientific consensus that you would get from other channels. I mean, anybody can pay one scientist to say whatever whatever you need to say. So it said here, and then it goes on to talk about testing and isolation. Anita was reading this article, and it has the exponential growth curve, and I want to talk to you a little bit about this curve. It says other countries have beat back the virus without such drastic measures, right? Talking about France and 100,000 police officers patrolling the streets and so forth. One example is South Korea, which has seen confirmed infections drop from 909 cases on the 29th of February to just 74 early this week. South Korea is a democratic republic. We feel a lockdown is not a reasonable choice, says Kim Woo-ju, an infectious disease specialist at Korea University. Instead, the key to success has been a large, well-organized testing program, combined with extensive efforts to isolate infected people and trace and quarantine their contacts. By 16 March, South Korea had tested more than 270,000 people, many at a network of dozens of drive-through testing stations, a strategy followed elsewhere that eases access to testing and prevents infected people from exposing others in waiting rooms. Okay, but the United States, plagued by an overly bureaucratic system and problems with its test kits, has had a slow start. By 16 March, it had done only 74 tests per million inhabitants, compared with 5,200 tests per million in South Korea. Only this week did the United States begin to roll out testing on a mass scale. In Europe, Germany is a frontrunner with more than 100,000 tests processed per week, says Christian Drosten, a virologist at the Charité University Hospital in Berlin, who developed the test. But other countries have yet to scale up testing. If we don't have testing, there could be people walking around without symptoms who carry the virus and infecting others. Okay. The slow rollout has rankled Tedros, who repeats his mantra, testing, 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 almost daily. Countries cannot fight this pandemic blindfolded, he said at a 16 March press conference. They should know where the cases are. Marcel Saleth, a computational epidemiologist at the Federal Institute of Technology of Lausanne, agrees. At this point, 100% of the nations that got it under control did so based on testing and tracing, isolation, quarantining, he said. What's required is a determination to find every single infection and follow up on every potential exposure and break every possible chain of transmission. And that's why I wrote a petition on Move On and got almost 200 people to sign it, and we sent it about a month ago to Vice President Pence, asking him to adopt the World Health Organization's COVID-19 test kits because they were readily available, and we need to have those. All right. So those are some of the things. It says here, even if they start to test more widely, some countries may lack the capacity to trace the contacts of those infected. In the United States, the job falls to state and local health departments, which often lack the resources to scale up rapidly. It's going to vary immensely by jurisdiction, said epidemiologist Caitlin Rivers of the Johns Hopkins University Bloomberg School of Public Health. One way to solve that is to engage the public more actively, says Luciana Borio, the pandemic preparedness point person at the U.S. National Security Council from 2017 to 2019. Borio hopes infected people, if properly educated, will isolate themselves and ask their recent contacts to seek tests. 2. I prefer to empower and educate the population to be able to help them take matters into their own hands, she says. No end game. For many, the bigger question is, when and how will it end? It's now clear that humanity won't get rid of COVID-19 as it did with SARS, severe acute respiratory syndrome, in 2013, says Mark Woolhouse, an epidemiologist at the University of Edinburgh. We will be living with this virus indefinitely. Keeping it at bay might require locking down society for many months at staggering cost to the economy, social life, and mental health, at least until a vaccine is available. That is inconceivable to Woolhouse and many others. A few countries are now thinking about gradually letting the population build up immunity by foregoing a complete lockdown and allowing some infections to take place, preferably in low-risk groups such as children or young adults. That's the strategy Prime Minister Mark Rutte of the Netherlands announced in a televised address in the 16th March. By taking this approach, one in which most people will experience only minor symptoms, we can both build immunity and ensure that our healthcare system is able to cope, Rutte said. In a TV interview, epidemiologist Jaap van Diesel of the Dutch National Institute for Public Health and Environment explained that the goal was to titrate control measures to keep the demand for hospital beds below maximum capacity, a strategy called mitigation. The UK government last week suggested it wanted to build up herd immunity as well, but began to backpedal after receiving pushback. A modeling study by researchers at Imperial College London posted online on 16 March concluded that even a mitigated epidemic would still overwhelm healthcare systems and cause at least 250,000 deaths in the United Kingdom and more than 1.1 million in the United States. Suppressing the virus by combining all available measures, including school closings and social distancing of the entire population, is the, quote, only viable strategy at the current time, unquote, the team wrote. It did suggest a scheme in which these draconian measures could be relaxed once in a while, a kind of collective drug holiday, and then reimposed when the case numbers started to climb again. In that scenario, the population would still build up immunity to the virus, but through a series of small outbreaks instead of a massive one. It may not be an attractive scenario, but there may be no other choice. As epidemiologist Seth Berkeley, who heads Gavi, the Vaccine Alliance, says, you cannot say the Earth has to stop for a year or 2 years. And that's with reporting by Dennis Normal and Martin Enserink. And this is Eduardo Rivero, live this 1st of April, 2020. a great evening from Downey, California.